Hi, I'm Courtney Knatz, and this is my internal feeding validation. So before I go in and talk to my patient and start the internal feeding process, I am going to check my healthcare provider orders just to make sure I have all the supplies I need and I have the correct formula. I'm also going to look at my patient's lab values and my patient's baseline weight just to make sure everything's good and the feeding will be good for the patient. The next thing I'm going to do is go introduce myself to the patient. Knock, knock, knock. Hi, I'm Courtney. I'm going to be your nurse today. I'm going to provide my patient with privacy and I'm going to wash my hands. We're going to be doing your internal feeding today so you can get all the nutrients that your body cannot get on its own. Can I have you say your name and date of birth, and can I see your wristband? Awesome. Thank you, Mrs. Johnson. Do you have any food allergies by chance? No? Okay. Now I'm going to look at you. I'm going to auscultate your bowel sounds and I'm going to assess your abdomen. This is just so we make sure that everything's good and that your internal feeding will be safely administered. I'm just going to have you lay on your back. This will only take a few seconds. Also, I'm going to make sure that I am auscultating under my patient's clothing, and I'm auscultating in each 4 quadrants. Sometimes it can take up to 3 to 5 minutes to hear these bowel sounds. Awesome, everything sounds great. And then I would be assessing my patient's abdomen after just to make sure everything looks normal. The next thing I'm going to do is place my patient into a 30 to 45 degree angle. This is just to make sure my patient doesn't aspirate or choke while eating. This also needs to be in this position for 1 hour after at least, just to make sure that there's no aspiration, like I said. The next thing I'm going to do for my patient is I am going to take the formula and verify it with the healthcare provider orders. I'm going to check the expiration date, and I'm also going to check the outside of the container just to make sure everything's intact. Next, I am going to shake the formula thoroughly, and I am also going to use an alcohol swab just to clean the top of it. The next thing I'm going to do after that, if it's an open bag, I'm going to pour the formula straight into the open bag and then hang it. If it is a closed system, then I'm going to attach the tubing to the container and then hang it from there. After that, I'm going to verify the placement of the tubing. This has to be done every 4 hours just to make sure the patient is receiving their nutrients in the correct area. The next thing I'm going to do is look at my patient's gross residual volume. I'm going to do this by taking 10 to 30 milliliters of air in a syringe, attaching the syringe to the tubing, and ejecting the air, sorry. Then I'm going to pull back and allow the aspirate gastric content to come out. If my gross residual volume is 250 milliliters or less, this can all go back into the patient's stomach. However, if gross residual volume is 500 milliliters or more, or in 2 measurements with 1 hour apart from each other, it is 250 milliliters or more, then we are going to stop the feeding and not feed the patient. When I get this gross residual volume, I'm going to note the appearance, the volume, and the pH of it. The next thing I'm going to have to do after this is I am going to take 30 milliliters of water and flush out the tubing. This flushing needs to be done before and after every intermittent feeding and every 4 hours for continuous. The next thing I'm going to do after this is label the administration bag, the administration set, saying tube feeding only, just so no one else puts anything in the patient's tubing. The next thing I'm going to do is take that bag that has the feeding, and I am going to label the bag with the type, the strength, the amount, the date that it was given, and the time that it was given, and then my initials CK. I'm going to change this administration bag every 24 hours. And I just want it to be known that this whole process is aseptic technique. Next, for the administration of the continuous or intermittent feeding with a pump. To administer, I'm going to pinch the proximal end of the feeding tube. This will remove the cap, and then I'm able to attach the tubing to that. Then I'm going to attach the tubing to the feeding pump, and this will help me set my infusion rate. This infusion rate can be advanced with healthcare provider orders, whatever they have ordered. I just want to make sure that after this, we are knowing that during the whole process, for intermittent, the whole tubing needs to be flushed before and after every feeding, and for continuous, it needs to be flushed every 4 hours. After this, I'm going to wash my hands, and I'm going to document this. Make sure your patient is in the 45-degree angle for at least an hour after to ensure their safety. Make sure the patient's comfortable, has their call out in reach, and then let me know if you need anything else. That's it.